What is chronic gastritis, and how is it different from acute gastritis? Have you ever wondered about the differences between chronic gastritis and acute gastritis? Both conditions involve inflammation of the stomach lining, but they have distinct characteristics. Let's break it down. Chronic gastritis is a long-lasting inflammation that develops gradually. It can persist for weeks, months, or even years. This ongoing irritation can lead to damage in the stomach tissues if left untreated. On the other hand, acute gastritis is sudden and temporary. It usually lasts from a few days up to about 10 days. Acute gastritis often causes more intense pain but resolves quickly once the cause is addressed. One of the key differences lies in the onset and duration. Acute gastritis appears suddenly and does not last long. Chronic gastritis develops slowly and can last indefinitely without treatment. Now let's talk about the causes. Acute gastritis is often triggered by irritants. These can include excessive alcohol consumption, certain medications like non-steroidal anti-inflammatory drugs, bacterial or viral infections, stress, or bile reflux. Chronic gastritis, however, commonly results from long-term infection with Helicobacter pylori bacteria, autoimmune reactions, prolonged use of non-steroidal anti-inflammatory drugs, or persistent irritants. When it comes to symptoms, both types can cause nausea, vomiting, indigestion, loss of appetite, and a burning sensation in the stomach. Acute gastritis usually leads to more severe and sudden abdominal pain. In contrast, chronic gastritis pain tends to be milder but can be persistent or intermittent over time. The effects on stomach tissue also differ. Acute gastritis may cause temporary erosions or ulcers in the stomach lining. Chronic gastritis can lead to thinning and wearing away of the stomach lining. This can sometimes cause changes in stomach cells, increasing the risk for ulcers or even stomach cancer. For those with sensitive stomachs, irritable bowel syndrome, or colitis, managing gastritis is essential. It involves careful attention to diet and lifestyle to avoid triggers that worsen stomach lining irritation. Avoiding non-steroidal anti-inflammatory drugs, limiting alcohol, managing stress, and treating infections promptly are all important steps. Since chronic gastritis can be subtle but damaging over time, regular medical checkups and appropriate treatment are key to preventing worsening symptoms or complications. In summary, acute gastritis is a sudden, short-term inflammation often caused by irritants or infections. Chronic gastritis is a slow, ongoing inflammation usually linked to persistent infections or autoimmune issues. Each type requires different approaches to treatment and prevention, especially for individuals with sensitive digestive systems.